All right. Hello, everyone. I am Shrutika Yola. I wanted to thank you all for joining today's member webinar, Organizational Change Methods to Decrease Burnout. As a courtesy to our presenters, all attendees have been muted. However, we encourage questions to be asked throughout the presentation. Please utilize the Zoom Q&A box for questions you may have throughout the presentation. The chat function is also available for discussion throughout the talk. Questions will be read aloud during the last 10 minutes of the webinar. Today's learning objectives are: identify organizational strategies to reduce employee burnout and improve engagement. Apply evidence-based practices and behavioral change models to reduce employee burnout. And 3, apply learned tools to advocate for organizational change. Today, we're joined by speaker Jessie Gavin. Jessie serves as the Wellness Director for Baylor College of Medicine in Houston, Texas. Since implementing the program in 2014, BCM has won numerous awards, including being named the nation's 3rd healthiest employer by Healthiest Employers LLC in 2021, 2018 WELCOA Well Workplace Silver Award winner, and 2019 KOOP National Health Award winner. Jessie received a bachelor's and master's degree in fitness and human performance. He is also currently pursuing a Doctor of Public Health degree from UTHealth School of Public Health. Jessie, take it away.
Thank you so much. And thank you for inviting me to be here today to talk about, not just burnout in general or what we can do as individuals, but burnout from an organizational perspective. I think I've been involved in wellness for around 17 years. And even whenever I got started, we really push challenges, water challenges, nutrition challenges, exercise challenge, and now we're getting into more mental well-being, financial well-being. So we're talking about budgeting and those types of things. But as I was going through, through my career and also into getting my doctorate, DrPH from UTHealth, I'm really starting to focus on what organizations can do to mitigate stress and burnout and to increase employee health. Before we get started, just the elephant in the room, there is a Christmas tree behind me, one of my wife's projects this year. So I know Christmas trees are usually fir trees, but now it's a beech tree since we are in that season. So I want to kind of set the tone, set the framework with just with some visualization and kind of seeing the two sides of the spectrum. So on one side, we'll talk about somebody that's on the way to burnout, and you'll see why. And then on the other side, we'll kind of flip the script and show the other side of that. So imagine that you wake up late, like many of us, snooze 2 or 3 times, and that last time you actually turned off your alarm and didn't hit snooze. You woke up late. The house is hot. The house is hot because the AC went out. And in Texas right now, in a lot of the country, that can be a huge issue, being in the hundreds. And so you didn't get very good sleep. You find out the AC is going to cost thousands of dollars. That morning, the kids are not listening. They're running around. You have to get them ready for school. You're already late. And so you're already getting frustrated in that regard. And then again, if you live in the Texas area, I actually live an hour south of Houston. I work in the Texas Medical Center, but I live in Clear Lake, Texas, which is about an hour if there's no traffic. But that day you actually see a helicopter flying in the sky, which is a tall tale sign that there has been an accident. And so that can be anywhere from an hour and a half to 2 hours. So you're already late, and then you're just going to be even more late. Whenever you get to work, you walk into the office. People are working remotely now, so there's not a lot of people. The people you do see really have their doors closed. Nobody waves, nobody says hi. The day goes on, your boss actually brings you into their office and they give you an assignment. Now, you know that this assignment is probably going to take 2 to 3 days, or it should. There's enough work to last 2 to 3 days. But right now you are short-staffed, and your boss says, I need this by tomorrow, which, it happens. They get things from the top down that said, I need this, and then they're going to pass it on to you. They say they need it by tomorrow. Because of that, you feel like you do not have time to take a lunch. You just have too much work to do, work on this project, work on the other things that you need to take care of. You don't take a lunch, you work through lunch. And then, you end up having to work late that day as well, just to try to get this project in. By the time you leave, you go home, your spouse is upset because, you actually were supposed to pick up the kids from practice that day. They're in all kinds of extracurricular activities, softball, things that we're dealing with right now. You're not able to eat dinner with the family because you have to work on this project that's due tomorrow. So you're in your office. So you really haven't ate too much that day. You really haven't been hydrated that day. So you're really frustrated. And then you finally get to sleep. But again, it's hot. So you're not going to get enough sleep that night. So we call this person Burnout Bill. And some of that might be applicable to some of those might be what you're going through or what you go through on a daily basis. So you can imagine, maybe not one day, maybe it was just a really bad day, and that's fine. But whenever those bad days are back to back, or whenever it's in a job that you're not really totally passionate about, not really totally engaged in, those are telltale signs that lead to burnout. We'll talk about why in just a little bit. Now let's think about on the flip side of that, a positive day. So you wake up fine, you were rested in the morning, kids are ready to go to school, they're excited, everybody's having a good time, you have a really good breakfast, you leave for work, no traffic that day, it's really smooth sailing that day. And whenever you get to work, everybody's happy, everybody's smiling, everybody says hi. A coworker actually brought breakfast for you that day. So they brought kolaches and donuts, a little treat, even though you had breakfast. Your boss called you into that office that day, but this time your boss says he just wants he wants to thank you for a good job that you did the previous week. He said, you did really good on this project. You worked really hard. People took notice of it. I just want to say thank you for that. Your day goes on, you have a great lunch. You actually go for a walk that afternoon. You have about 10 to 15 minutes. You can take a walk. You ask your boss, say, hey, my kids have some practice today. I was wondering if I could take off a little bit early to go watch the end of their practice. It's my job to pick them up today. And your boss says, yeah, no problem. That's fine. You have a little bit more autonomy in that regard. After the practice is over, you take the kids to ice cream, go home, have dinner together as a family, talk about your day, even watch a movie together, and then you're able to get to bed at a decent hour. So you could see how those 2 days are drastically different. And some of those things are not in your control. And to say all that, again, to kind of set the framework, is that context matters. The environment that you're in matters to your overall well-being. So again, I think one of the biggest issues with traditional wellness programs, occupational wellness programs, or even wellness initiatives is their focus on individual behavior. So what can you do to increase your exercise? What can you do to eat more fruits and vegetables? What can you do to practice mindfulness, practice meditation? But you can imagine if you are understaffed, overworked, you're not really engaged in your job, you getting more and more projects that you can't handle. And I come to you as a wellness professional and say, you know what you need is resiliency training. What you need is a mindfulness app, and you're fine. You're probably going to give me the middle finger because there is nothing that you could do. You say, well, let's get more people. Let's do these other things that can help reduce my stress and burnout. And you can imagine as well that there's what's going on right now around the world, COVID-19, right? A lot of things that are happening with COVID-19, people in the past 2 years, people were not able to be around each other for a long time. One of the biggest things that decreased during COVID-19, the start of it, was social wellness, mental well-being. People couldn't get together and have that relatedness that we'll talk about in just a second. There's been a lot of social unrest in the country. There's been a lot of violence. There's been a lot of in other countries, there's been problems, concerns of inflation, energy costs. Myself, we actually 2 months ago, we actually switched energy providers. Our contract was up. We were paying 5 cents per kilowatt hour. Whenever we signed on to this new company, we were now paying 13 cents per kilowatt hour. And that's actually low. If you go to a website like Power to Choose, there's some energy companies right now that are 14, 15, even 20 cents per kilowatt hour. So my electricity bill went from $250 during the summer to, I think the last one was $650. So you can imagine that those outside things are going to have an impact on you. I just saw a news article about monkeypox. That's another scare that people are having. So again, just know that the environment matters, and that's really what we're going to talk about today. So burnout is growing. It affects 50% of the general population. In the healthcare community, it's even higher because they're dealing with a lot of situations, a lot of critical situations, a lot's expected of them. Sometimes they have decreased autonomy. They don't have a lot of say in what they do. A lot of healthcare professionals don't take a lot of their vacation time. It's a very altruistic community, right? And it's a very altruistic profession. You give a lot of yourself to other people. And a lot of times, whenever that happens, we tend to forget about the engine that drives that, which is ourselves. And so we tend to put ourselves on the back burner to handle the well-being of others. And that's something that we really have to look at. Some of the consequences of burnout: depression, adverse coping mechanisms like alcohol and drug use, decreased social health, and even studies show that there is an increased risk of suicide and suicide ideation, which is basically just saying that people have thoughts about committing suicide because they just, nobody to talk to, and it is kind of reaching the wit's end. From an organizational perspective, there's actually studies that show that increased burnout, decreased engagement can lead to increased malpractice lawsuits. Well, why is that? Well, because you're not really fully there, right? You're thinking about the AC, you're thinking about the family issues, you're thinking about the bad day you're having, you're thinking about all these other things, and you're not mindful about what you're doing in the moment, and mistakes can happen, right? Decreased patient care, and then overall increased turnover. People are leaving the job because they can't take it anymore. So there's something that is really coming out right now called the Job Demands Resources model. And what this model shows basically is that when job demands outweigh resources, then you're at increased risk of burnout. And so this is actually really designed for the clinical setting. But I can tell you that some of this is personal as well. And that's one of the things that I think that we can do better at in burnout. Burnout is really set aside for the organizational setting. But we'll talk about what we just talked about. You can see how personally this holds true as well. So basically, the job demand resources model, it says that when your demands outweigh the resources that you have available, professionally and personally, you're going to be at increased risk of burnout. And burnout is just basically untreated stress. So chronic stress that's built up over time. So you can see some of the things we just talked about: excess workload, unmanaged work schedules, decreased autonomy. And I won't read all this. I believe everybody will have access to these slides, but EMRs, big right now, inadequate technology usability. So a lot of systems that are put in place and things that are required of medical professionals. Patient factors, moral distress, and some of the resources that could come along with that. So culture, again, I mentioned people saying, hi, how was your day? How was your night? Having that autonomy, wellness programs, offering recognition and appreciation. So your boss calling you in and saying, hey, I took notice of that great job you did. I just wanted to let you know that. Your boss letting you leave early. A lot of trust back and forth, not really micromanaging. So say, yeah, you've been working really hard. If you need to leave a little bit early, go to your kids' practice and take them ice cream, whatever you got to do, that's fine. Go ahead and do that. And so that occupational, but also, personal demands, the AC, financial issues, not being able to see everybody, resources, having a good social circle, people to talk to, friends to go and hang out with. Those, so you could, again, not just professionally, but these things apply personally as well. So again, this is just another research study that talks about the different causes, and we'll talk about kind of some overarching structure that can help out with this in just a little bit. So I really want to talk to you about the self-determination theory and also the basic needs sub-theory. And the link here actually shows, it's a global culture report, OC Tanner, which is basically a research organization. They do a lot more, but similar to Gallup, they're a research organization, and they actually talk about basic needs and how that can increase motivation and engagement. So the self-determination theory discusses how we are motivated. It talks about how we grow, again, both professionally and personally. So one of the sub-theories in that says that to be engaged, to be our full selves in the workspace on a daily basis, 3 basic needs have to be met. One of them is autonomy. Autonomy is basically just feeling like you have control over your day. You have a say in the projects you're in, you have the say in what you do on a daily basis, you have a kind of a feeling of control over your time. And another one is mastery. So learning new skills, being more proficient at your work, continuing education goes along with mastery. And then relatedness. So people have to feel like they're connected to the organization and connected to the people around them, connected to their peers. So all these things, unless all 3 of these things are met, then people are not going to be as engaged. They're not going to be as motivated. They're going to be very disconnected from work. And then all this can lead to burnout as well. So what are some things that we can do from a clinical entity perspective? There's a study that looks at the faculty, trainees, and even the organization to help out with these basic needs. So faculty or even senior leaders, managers, and supervisors in your organization, what can they do to increase these basic needs? One of them is burnout surveys. So increasing, and that also goes back to competence is basically mastery. So same thing. So learning new knowledge about what burnout is, what are the symptoms of burnout, and how you can mitigate that. Again, a lot of these are pointed at individual factors, which shouldn't be the case. We need to also look at environmental factors. What can we do, which we'll talk about in just a second. Intervention workshops, EAP programs, letting people know that there's people that they can reach out to in a safe manner to talk about any issues, reducing the stigma of mental health. I think a lot of people grew up in a generation where we didn't really talk about our feelings, especially in an organizational setting. We were taught that work is work, life is life, check it at the door. And we know that's not the case. We just talked about a lot of situations that can be happening in the workplace, in the home, that will affect your work. It'll affect you being present in your job. Supportive curriculum that shows those resources, mentorship programs will help. And that also helps, again, you see the same thing in relatedness, that kind of goes hand in hand. Peer-to-peer groups. At Baylor, we're actually starting some interest groups. So if you're interested in running, if you're interested in cycling, if you're interested in scuba diving, we are actually utilizing Microsoft Teams. And so you can just join that Teams interest group and talk to each other. I think that's, one of the things with technology, a lot of times we go into a meeting and where people used to say, hey, how are you? How was your night? How are the kids? How are those activities that they're participating in? Now, a lot of times we go into meetings and we're sitting there and what are we doing? We're on our phone, right? We're actively disengaging with others. I think nowadays we tend to go out of our way to not talk to people. And again, partly because of COVID-19, we got used to that, not being around people and being in solitude and being isolated. So autonomy, having trainee representation in the faculty council, or having a multi-level stakeholder group. And so even if it's not, again, not faculty trainee, but supervisor employee. So if you have a working group, make sure that that working group is representative of your entire workforce. Make sure you have somebody that can speak to each level within the organization. That's going to help make them feel like they have a more of a say in what's going on, and more transparency. And then an educational board to meet needs of trainees. So what can the organization do? They can, again, for mastery, we have a reading group. We also have some books. We have access to the TMC library to increase the knowledge. We actually, and again, I'm speaking of Baylor because, that's what I know, and I can speak to it. But we actually just started a learning management system this year that, you can become Six Sigma certified. One of my employees actually just took a project management course, 2-day course for free because it was in that learning management system. So she's learning new skills, increasing her mastery in other related subjects. One of our employees in the wellness initiative is really interested in financial wellness. So she's actually working really close with our retirement team, who we partner with on our financial wellness initiatives. And so she's increasing her mastery in that way. Some organizations, if you ever look up, how sticky notes were invented. So a lot of companies will include, there's different names for it, but basically they'll include time that employees are allowed to work on whatever they want. Anything non-work related. They can work on a new idea. They can work on a side project. And so I believe, if I'm not mistaken, the sticky note was created during that period of time where someone was just, in that period of space, creativity space, and said, this would be a great idea. And so that they weren't an inventor. It wasn't part of their job. They just kind of did it by chance. How to increase relatedness. I mentioned social groups, social gatherings. I think that's another thing that companies are really getting away from, are things like company picnics, getting people together as a family, meeting each other's kids and extended family. And I think that's very important. That is what helps people feel connected to the organization. I mentioned Gallup being, like OC Tanner, being a big research institution. They have done a lot of studies that show if people do not feel like they have a best friend at work, they're going to easily find another job if things get rough. So if people have individuals, peers that they connect with, they can probably stick it out because they have people that they can talk to. They have people that they can rely on. They feel closer to those individuals and to the organization. Again, I won't read through all of this. But then again, autonomy, flexible schedules, quarantine study time, or again, quarantine idea time, quarantine time, protected time, which is something that we'll talk about in just a little bit that you're seeing a lot more of. I actually did a qualitative, it wasn't published, it was a part of a course, but I did some research on burnout and this instance of basic needs. And I heard from a manager in a clinical setting that used to be a nurse. And she said, Jesse, the time that I felt that I had the most autonomy was whenever I was a nurse, because basically what they did was that on a whiteboard, they said, this is the coverage we need. These are the hours that we need filled in. And it was up to them to go up and put when they wanted to work. As long as they had coverage, they could fill in those spots. And she felt like she had so much say and control over her time, because if she wanted to take vacation, she just didn't write her name in. If she needed to go take care of an errand, she just didn't write her name in on that day. So they had a choice of when to allocate their time. And again, we'll talk about this in just a little bit, but there are organizations that are implementing some of those change methods in models. So again, what can trainees do? And again, this isn't really focused on individual change behaviors. I know that Shatika and everybody on the administrative council for this presentation said that you've done burnout presentations before that talked about how you can increase exercise, make sure you're getting the right amount of sleep, how you can do your part, which is very true. Those things are important. They are essential. It's important to have very positive coping mechanisms whenever these things come up. But I am a firm believer that a lot of the resources that and again, coming from a wellness, I've done wellness for, again, 17 years. I'm a wellness director now. Sometimes I feel like we just put in a resource as a Band-Aid, right? You're bleeding. You're very short-staffed. Let's put a Band-Aid over it and show you how to be resilient. But then you turn around the next day and it's the same, right? We're telling people that fast food is bad for them, but that's all that they can find in their neighborhood. We tell them that exercise is good for them, but we're taking away the parks and we're taking away physical activity in different spaces. We're making it, very expensive to go to a lot of these facilities and be active. So individual initiatives are important, but so is environment. And we really need to merge those together. So from a trainee, from a staff perspective, from an individual perspective, what can we do to increase our mastery? We can learn more about our personal strengths. What can we bring to the table? There's certain things that companies will do called like strength finders, is one that kind of show you where your highest levels are of strengths, and you can put that, build those into what you do. Which was very important, but also again building on your weaknesses. So learning new skills. I have a friend that what he chose to do during COVID was learn the cello. I don't know why. He's just, I guess he was already had a fascination with it, but because he wasn't able to go out and do things, he rented a cello and he has been taking lessons, and he's actually been pretty good at it. He found a new passion for it. So I think that's one of the things that was one positive that came out of that, is that people really started to find new things that they were interested in. And now that they were working from home or had a little bit more time, they were able to put towards doing these new skills. Attending courses, there are some free courses out there. Course RA is one that is out there. So they actually have some institutions that will pull out their real courses for free online. Again, it's not accredited. You're not going to get a degree from going through those things. But again, increasing new skills. I mentioned that I'm getting a degree, a doctor of public health degree. So I'm getting a public health degree. But I am very interested in learning more about the emerging field of organizational psychology, which is along those same lines. How do we change the work landscape to better fit employees? And so there's some courses that I could take on organizational psychology to just enhance my skill set. Self-awareness, mindfulness, we talked about that. Understanding burnout. This is a great example. Learning about the signs, the symptoms, which are basically just cynicism. Also, having that decreased self-efficacy, feeling like you can't do the job, you resent your job. Which can, again, over time lead to a lot of catastrophic things. Relatedness, social support from others, peer mentoring groups, study groups, and then autonomy. From an individual perspective, you can do more. You see a lot with time management courses. That's something that we actually teach, time management and how to make your day flow a little bit better in that space. But again, outside factors occur. You have to know that bumps in the road are going to happen. And that's kind of where resiliency comes in, right? So nothing is ever going to go according to plan, but how we react to those situations is under our control. So if you have the picture that I showed, some people hate traffic. I was in the huge traffic lines whenever the hurricane hit, whenever I was a little bit younger, and we were traveling north, and we were in a trip that should have taken 9 hours took almost 18 hours. And so I despise traffic. I will literally leave 2 hours early to get somewhere and wait in my truck before sitting in traffic. Like that's how much I hate traffic. It just makes me anxious now. Which again, that might be a little bit of PTSD. Never really talked about that before, but that's the first time I've actually thought about it. So thank you for being my therapist on the call today. But it probably is a little bit of PTSD. I literally get anxious whenever I'm sitting in traffic. I don't like it. But some people don't mind it. They crank the radio up and you see people singing in the car and they'll just go for a drive. They just love the time sitting in the car and being by themselves and love that alone time. So all that makes a difference. Setting time for relaxation. We talked about wellness and also taking your vacation. There's a lot of studies that point to in the United States, we don't take as much vacation as we can, or don't take the vacation that's even allotted to us. Again, because we feel like either we can't or there's too much work to be done. We'd rather not take vacation because we know whenever we come back, we're just going to have that much more work. We answer emails on vacation. We really don't disconnect. And so that's become a huge issue. So here's another study done by the Mayo Clinic. And again, we won't go through all this, but just some organizational strategies that can help reduce burnout, especially in physicians. So acknowledging and assessing the problem, I think that's so important. As an organization, you have to take a look in the mirror. And I tell people that I talk to that all the time. They say, Jesse, how do we reduce our burnout? And we talk about the strategies and they say, yeah, I don't think that's really going to work, or I don't think we're going to be able to implement that. And they have to sit back and think that if you're having everyone tell you, we are short-staffed, we are stretched to the limit, we are on the brink of burnout, being stressed out. And you say, yeah, I hear you, but that's just not something that we can do right now. That's not okay. That's not going to work. You have to take a look in the mirror and say, if I'm being told this is what my people are saying, I need to do something about it. The real solution. Addressing senior leaders is always important. There's a lot of studies that show wellness programs, anything, change initiatives in general, you're going to need senior leadership support. So that's very important. Implementing individualistic and targeted interventions. That's kind of where we go back to, maybe people aren't getting up enough. Maybe they're sitting at their desk. Maybe they feel like they can't get up, right? There's still people in our organization, in Baylor. We've been around since 2014 is whenever I was hired. There are still people that tell us they feel like they cannot get up and take a lunch break. That is not okay, right? And it's not just, hey, you can go do it. That takes a shift in mindset. That takes a shift in perception to change those things. I think culture is one of the hardest and the last things to change in workplace wellness. I had somebody tell me a long time ago that people put in resources because the opposite is true, right? So if you have, we'll take sexual harassment, for example. If you have the only reason that you are, aside of policy, but in real time, if you're implementing, say, hey, everybody has to go through this sexual harassment training, it's probably in reaction to an incident, right? Or psychological safety. People feeling they can express their ideas. People feeling like they can bring their full selves to work. If you feel like as a leader that your group, your department needs psychological safety training, it's probably because there's a lot of people that don't feel psychologically safe, that they can speak their mind and they can, come in and bring new ideas and those types of things. So that's really where it starts, right? If you can build an organization that is who you are, that is fundamentally in the policies and procedures, and it's well known from the time that you accept a position in your organization to the time you no longer work there, and even after exit surveys, every experience matters. And so you can imagine how much that plays a part into your overall ideology of that organization. And so if you come in as a new hire and they say, look, this is who we are, you're able to get up and walk around. We're very laissez-faire about some things. There are some times that we're going to be very busy. We're going to expect you to put in some work. But there's also going to be some times where if you're not busy, don't act busy and look at YouTube. Don't shut your door and act like you're just working on a project when you're not. Take a break, take a walk, because there are going to be times when we are going to be busy and we're going to need you to put all of your effort. Building that community is really important. Rewards and incentives we talked about, building that culture, having the flexibility, that work-life integration. Again, it's not work is work, it's not life is life. There's a huge gray area, and we need to understand that as professionals and as organizations, is that what happens outside of work directly impacts how we operate inside of work. And we really need to understand that. And there's not one is one, the other is the other, and they don't mix together. And another example, I talked to a construction company and they said, you know what, Jesse, because if you've ever worked for oil company, construction company, the safety is their number one thing. You have to be safe. If you're not safe, you're kicked off the job site, no matter who you are, contractor and employee. If you're not safe, you're kicked off the site. And I said, they are so embedded in safety. How do I bring in wellness? And I talked to him. I said, well, let me ask you a question. If you're not eating right, if you're not hydrated, you're not sleeping well, you have financial troubles, you had a fight with your spouse, and you're operating a piece of machinery and thinking about all those other things, that can cause an injury, right? And he said, yeah, that can. That's easy tie-in. Those things at home that are happening cannot just be turned off and now you're fully invested in operating a crane or $1 million piece of equipment that can easily, one slip up can easily injure somebody else, right? So they're embedded together. Offering those resources, and then we talk about organizational psychology, organizational science, some of those things, research-based initiatives, some of those things that we're going to go through in just a second. So what are the things that we're looking at right now? And these three things are really what I am focused on. My dissertation is actually going to be on manager training. And we'll talk about that just a second. But one of the things that people are really looking at right now, nationwide, globally, is reduced work weeks. The 40-hour work week model, the Fair Labor Standards Act, was implemented in 1940. You can imagine how different our lives are between now and 1940. And we are still operating under that same model of 40 hours a week. And a lot of times that's just exempt or non-exempt, right? People work 50 hours, they work 60 hours. And so one of the things that are really being looked at is reducing the 40-hour work week model to 32 hours. So now now you're not working, it's 32. And again, you could do that and people are still going to work more, but now people feel like they have perception that they can take that time away. People can handle their errands on a weekday now, whenever they might be stressed out. You have more autonomy in your day. And it's not one size fits all. I want everybody to understand that. People say, well, how is that going to work in customer service settings? How is that going to work in a hospital system? You're going to have coverage. There's going to be different plans for everybody, but there's actually research on different ways they can do that. So there's an Ireland study that came out with practical ways to implement reduced work weeks. So again, 40 hours, I'm not talking about compressed work weeks. I'm not talking about 410s. I'm not talking about 980 schedules where you have every other Friday off, because again, you're putting in the same time. You're just compressing that in. I'm literally talking about being paid the same and reducing work hours from 40 to 32 hours. And we'll talk about some more of that in just a second. So this Ireland study said that you can do a couple of things. One is job sharing. So a lot of times in an organization, you have one person feels like they have too much to do, and another person that feels like they do not have enough to do. So put them together. Say, if you have a lot to do, talk to your teammates, and maybe you can offload some of those things. So job sharing, meeting autonomy. Those of you sitting on the call today and on the webinar, think about the last 10 meetings you sat in, and then think about how many of those meetings you actually had direct input, direct oversight, or direct decision-making abilities. What you'll find is that probably not a lot. I don't have a real number, a scientific number, but a lot of people come out of meetings and they say, why was I in that meeting? There was no reason for me to be there. Somebody could have told me what it was about afterwards, and I would have been just fine. So I just wasted an hour of my day in something that I could have read in 2 minutes. And so what they did was they said, okay, you know what? You get to choose the meetings that you attend. So you have, say you have 5 meetings. You can say, okay, well, I'm going to go to these 2 because they are requiring me to make a decision that day or something like that. So now you just save 3 hours in the day that you can read on an email. So that was some of the things that they implemented. We talk about varying schedules. People talk about coverage in that. And so everybody thinks that reducing work hours is Fridays. And it doesn't have to be that way, right? Some people could take off Tuesday, some people take off Wednesday, talk to employees, figure out what their needs are, and figure out what works best for them. Maybe rather than taking a whole day off, maybe they would just rather take a couple hours off each day, right? And so maybe that's an option. And this also takes kind of a mind shift, right? A lot of companies, they say, well, you're providing me a service, hours, I'm paying you for this number of hours. But you got to kind of think, are you paying me for the minutes that I'm at there or the hours that I'm there? Or are you paying me for the work that I produce, right? Are you paying me for my creativity? Depends on the job, sometimes. But if someone takes 10 minutes to do a job versus somebody that takes an hour, why should the person and they produce the same amount of work, A+ work. You think that the person that works an hour should be paid more because they did it in an hour versus person that can do it in 10 minutes, just as good, right? Or, should somebody do it in 10 minutes and be able to leave early? So those are things we have to think about. Currently, it actually started in June. There's a nonprofit that's called 4-Day Week Global. You can look them up. They're all over LinkedIn. They're all over Facebook. But they actually started a 6-month pilot in the UK and the US in June. So by the end of the year, we're going to see a lot more data on reduced work weeks and the 32-hour work week. There was actually, in the summer of 2021, a representative from California. California always seems like they're jumping in and stirring the pot a lot, but they're very innovative and they want to try new things. So Mark Takano, a representative from California, actually introduced the 32-hour Workweek Act. And it's still going through Congress. There's revisions being made, but it's those steps that are going forward. Mandatory manager training. As we stepped into COVID, we had a lot of managers that were used to managing in person. All of a sudden, you have to learn how to keep people engaged remotely. You have to learn how to organize meetings, conduct webinars remotely. And we provided no training on how to do that. We expected everybody just to flip the switch and say, you're a manager in person, you got to be the same manager over online for remote workers. So we have to make sure that if we expect this much of our management staff and our supervisors, we have to make sure that we're providing them the skills. We have to make sure that we're providing them the knowledge to pass on these change methods. So that's what my dissertation is about, is a 12-week course, short. Again, the time, a lot of senior leaders don't have too much time, but it's education on burnout, how organizations play a role in that, increasing basic needs, things that they can do to help out with this. And basically, it's designed to increase implementation intentions of some of the things that we talked about: wellness programs, interest groups, peer-to-peer groups. And so, I'm hoping to do that next year. Something that a lot of organizations are doing right now already is introducing protected time. So they'll say, in a given week, you have 2 hours of protected time. I'll be honest, most of the time people will use this for physical activity benefit. You'll say, okay, you can go to use the gym for a couple hours every single week. Like, that's your time, it's protected time. Some organizations are saying, and this is actually something that Baylor's looking at, is that we are looking at maybe implementing 1.5 to 2 hours of self-care time. You can use that to go to our on-site clinic, Because again, a lot of barriers, perceptions, people feel like they don't have, if they need to go to the on-site clinic, which we want to drive participation, then it takes time to get up, take the shuttle over there, do your appointment, and take the shuttle back, probably a couple hours. And people will probably not drive back into the medical center because, again, some people live an hour away. In Houston, Texas, we're very spread out. And so if people feel like they have 2 hours in the week that they can go take care of that, it's going to reduce some of those barriers. You can go for a walk. Ideally, you don't want to say, well, now you can take a lunch break. I mean, you should feel like you should be able to get away and take a lunch break. There's actually a law that was introduced in Quebec in Canada that actually said it's a disengagement from work act. It's a law that people have to have a certain number of time each day to be completely disconnected from work. So lunch, after work, I mean, maybe that means not having work emails on your phone at all. So that's a law that they did. So again, a lot of stuff's coming out about this, about organizational change methods. So what can you do? Just to wrap up here, we learned a lot about different things, burnout, what the research shows. Well, what can you do? You say, I'm sitting here and thinking, yeah, this all sounds great, but what do I do next? We'll start with the easy wins. Those 3 things that we talked about: introducing protected time. Anytime you introduce a policy, it could take a while, right? Especially in a place called Baylor College of Medicine. There's a board, there's senior leadership, there's a lot of things that we have to go through to implement a new policy. And reduce work weeks, you can imagine that's going to take time. It's not going to happen overnight. But if you could just maybe increase the manager training, you can find different things, different resources online. Maybe there's courses that they could take now about having empathy, psychological safety, increasing communication and transparency. There's a lot of enhanced manager training that we can put out there. I talked about learning management systems, letting people learn new skills, like Six Sigma, project management, bettering themselves to do better work in what they need to do. And then increasing awareness, knowledge, coping skills. That's where wellness programs come in. Those things are very easy to implement. You don't have to spend a lot of money to increase awareness about burnout, what it is, and signs and symptoms to look for. Teaching about coping skills, coping mechanisms. Not drugs and alcohol, but exercise and peer-to-peer groups. Another thing you can do is start to assess and analyze. We talked about the Miles study. The first thing that you can do, do feedback questionnaires, organizational questionnaires about the rates of burnout. How many people are feeling signs of burnout? How many people are feeling low self-efficacy, like they can't do the job that well anymore? Or how many people are resenting the organization? How many people are suffering from extreme exhaustion? They are just wiped out at the end of the day. And so we have to kind of assess what's going on and analyze the resources that we have and what we can do going forward. I'm a huge believer in transparency. I think that one of the things that we really did great as an organization whenever COVID started is that we had weekly communication about what Baylor was doing, what was going on around the world. The thing, we had some doctors that were working on vaccines at the time, Dr. Peter Hotez, which was very great, might win the Nobel Peace Prize. And so I'm very prideful of that. I'm very prideful of what Baylor does, but they sent out weekly emails. They were very transparent about what we were going to have to do as an organization to make sure we stay afloat and not lose a lot of money. And then not just taking that feedback in, but you have to disseminate the results. Right. So a lot of times organizations will do a survey and it just goes into a filing cabinet somewhere. If people don't feel like their feedback is being heard, they're not going to take your surveys. They want to see, I provided this feedback. This is what's going to happen. And it could be as simple as that. This is the feedback we received. These are the steps that we're taking to do that. And you will be so surprised how easy it is to get people engaged and make people feel like they're valued, that their opinion is valued in the organization. And then experiment and pilot. We say this in wellness all the time. Wellness is a science experiment. Some things are going to work, some things are not. But it's not just throwing darts against the dartboard and seeing what sticks. Evidence-based research, things that are shown to work, Maybe that doesn't work in your population. Everybody's different. Organizations are different. Cultures are different. So, pilot these things, pilot with a small group. If you want to pilot flexible schedules, reduce work hours, pilot it with a smaller group, see how it does with them, maybe 20, 25 people, and then expand it, right? So start small. And these are just some references that I had throughout the presentation. But again, thank you so much. Again, I hope you learned, some things that's going on right now that people are looking at that and saying, it's not just individual behaviors that we can do, but as organizations, as senior leaders, these are things that we can implement to help reduce burnout. I hope you learn maybe some things that you can take going forward as maybe some action steps that work for you or work for your organization if you are in a management position. So I will turn it back over to Shrutika for any questions.
Yes, great. Thank you so much, Jesse. I think we all took a little bit of something away from your talk today, and a bunch of good questions came in as well. So tying into a lot of those changes that you brought up at the end of your talk, all great things to implement. But I would imagine that a lot of people on this call and most genetic counselors generally are not in higher management positions. In other words, most genetic counselors don't have the power or autonomy to make these changes. What is your advice for those employees? What tools are available for employees when their needs don't align with the goals from the organization or upper management?
I don't want to overstep my boundaries, but I think we talked about it in a setup call for this organization. I used to be a health coach with an organization, and we talked to a lot of people that said the same thing. But we have to sit down and think, if your values and your passion and your goals do not align with that organization, you have to make a decision for yourself about your future and what you want out of life, what your goals are. Is it to make money? Is it to grow old and retire and so you can spend time with your grandkids? You really have to think about what your purpose is. Maybe it's to do more in the community and really give back. And a lot of organizations are looking at that, how to give back to the community. But what I would say, and in wellness, we figured out that same thing, right? And so I would never imagine that we would be talking about a protected time policy or something like that. And I will say this, I know it's easier said than done. I am very fortunate that my supervisor is very hands-off. He trusts what I do. I'm able to go back to school and get my doctorate while I'm working full-time. I could not do that without his support. And I want to stress that. But that's a conversation that needs to happen. So that's what I would say. Number one is, and I hope, and it might take some confidence, take some time to build up to it, but just say, hey, can I sit down and talk to you about this? And again, a lot of that's breaking down the stigma, right? Mental health. If you need help, speak up, because a lot of times people don't. And you say, well, look, you gave me this projects. Can you, even if it's something as simple as, can you tell me which one's a priority? You gave me 3 projects in the past couple of days. Which one takes precedent? Which one should I really be focused on? They'll say, well, you could put those other 2 to the back burner. Let's really focus on this one. This one's really important. Or you could say, look, I hope you feel comfortable doing this. Is say, hey, look, I have a lot going on at home. I just want to let you know, hey, this is, I might not, I'll be there today. But I'm trying. And I want you to know that I'm here, I'm trying. But if I feel like I'm disconnected, this is why. So I think it's just transparency, it's trust. And again, culture is the hardest thing to change. There's still people, we ask these questions in our end of the year surveys, and people say, no, I told an idea to my boss, and my boss told me to keep my ideas to myself. That's at organization that we were trying to promote wellness for. So it happens, and it takes time. But just keep pushing and keep having those conversations with the people that matter, and it's going to trickle up there. It will.
Thank you for that. Another question that came in And you touched on this a little bit as well, Jesse, but when working in a remote environment with limited social interactions, how can we structure meetings with efficiency in mind while still being social? Because you mentioned that it's important to have that good blend of integrating personal life into the work environment. We're told to keep our video meetings to a minimum, i.e. this could have been an email, right? And to keep them as short and productive as possible. But then in turn, this eliminates small talk that would usually happen at an in-person meeting. How do we bring back water cooler talks when we're 100% remote?
I think one of the things that Zoom is very good at is that you can do breakout rooms. And so maybe if you could set up time in the meeting to have a breakout room, and so people can, and you can have some probing dialogue and say, okay, well, we're going to talk about your favorite animal or something like that. Because again, people don't connect. I was doing a presentation for a group, and I said, well, what's your favorite hobby? Because we don't really practice what relieves our stress. We don't practice anymore. And someone said, I love singing. I sing in my church group. I sing in the shower. I sing in the car. I sing everywhere. And a lot of people looked at her and said, you sing? What? We didn't even know that. And they worked together for years. And this is something that she was very passionate about. And so we don't do that anymore. We don't do water cooler talk. So I would say, set up some time, set up icebreakers in every meeting. Set up some time in breakout rooms if there's too many people, if you want to make it a smaller group and so it doesn't take up too much time. You can do that, and maybe just have people switch up the groups. Give people a say in the meeting agenda. A lot of people don't think about that, but that autonomy, having a say, is easy as just saying, your supervisor saying, hey, this is our agenda today. Is there anything you want to add, anything you want to talk about in the meeting? Talking about the objectives in the beginning of the meeting, say, this is what you should learn from this meeting. These are the things that we're going to go through. Or even designated somebody to keep you on point and keep you on track. Say, one of the things I tell, I feel like it's very difficult whenever we're doing a presentation and we're asking people for things and they've never seen it before. Why? Because you need time to think about it. You're not going to automatically know an answer if someone says, well, how about this graphic? Like, oh, it's okay. And then you come back 2 days later and you're like, I don't really like that. If you could send out things beforehand and say, hey, look at this. We're going to talk about this in 2 days. Can you bring some feedback to the meeting? That'll take out a lot of that dead space where people are thinking. Because you say, come with your comments, come with your feedback. So those are just some couple of things that come to mind.
Okay. I think we have time for maybe one or two more questions. So the next one, Jesse, in healthcare settings, how do we pay for some of these organizational changes, since many will lead to reduced revenue from clinical services?
I would not be able to answer that unless I would know why they think it would lead to reduced clinical services. Because again, you're not closing down the clinic. You're doing more of a rotation schedule. So if you can have, say you need 2 doctors, but you don't need both of them there every single day. Like one can take one day off, another can take the other one off. So in order to answer that question, I think I would need to know a little bit more about why they feel like reducing work hours or increasing protected time would reduce revenue. If that makes sense.
Sure. To tie into that, are there good talking points to even open the door to having that conversation with the people who are in charge of budget, who may turn down the idea with the idea that there's not enough revenue to implement these changes?
Yeah, I mean, I would say, introducing protected time does not cost money. Introducing wellness programs to a higher level might, but there's a lot of free resources. Implementing reduced work hours doesn't necessarily cost money, but you just have to make sure that there's coverage for your needs, whether it's call centers or seeing patients, and those types of things. But also the reality of it is that these reports and these pilots and these studies from Ireland show that reduced work hours increase production. They actually show that production is about the same. It doesn't reduce productivity. And so you're having people put out the same amount of work for less hours. And now they are more passionate about the company. It's a huge benefit. So you're reducing turnover. So a lot of these studies are showing that it actually revenue and production either remain the same or they go up. But again, there's scheduling and those types of things. It's not a flip of a switch. It takes a progression, but it can be implemented, and I believe it can be implemented in any sector.
Great, thank you so much. Well, with that, we are out of time. So if anyone has any additional questions, Jesse's contact information is on the screen, so feel free to reach out to him. This is the end of today's member webinar. On behalf of NSGC Webinar Subcommittee, thank you again, Jesse, for sharing your insight on this very important topic. This webinar recording will be posted to the webinar page of the NSGC website within 48 hours. Have a great day.
Thank you again. Have a great day.